You have seen the scan. The doctor points to the areas of calcium deposit, the narrowing, the early evidence of something that, if it continues building unchecked, represents the leading cause of death among older adults in the developed world. A medication is prescribed, a dietary change is recommended, and you leave the appointment with a strange, quiet feeling that sits somewhere between gratitude and incompleteness. Is that it? Is there really nothing else that can be done? I am Dr. Naira Stein. I have spent many years working with older adults on cardiovascular health and the management of arterial disease. And one of the questions I hear most consistently is some version of that same quiet one. Not defiance of medical advice. Most people I work with are taking their medications and trying hard with their diets. What they are asking is whether there is something else, something grounded in real evidence that addresses the biology of plaque in a way that the standard conversation does not fully cover. Today, I want to give you a specific and thoroughly researched answer to that question. It concerns a common ingredient available in any grocery store for under $2 that has now been studied in randomized controlled trials specifically for its effect on coronary artery calcium and soft plaque. The results of those trials are the kind that make cardiologists pause, and they are largely absent from routine appointments, not because the medical community is hiding them, but because the research is recent and the ingredient in question arrives without a pharmaceutical representative to ensure it reaches clinical conversations. Let me explain the mechanism, walk you through the evidence, and give you the exact protocol that the clinical research supports. As always, everything here is educational information grounded in peer-reviewed science, and any addition to your health routine should be discussed with your own doctor, particularly if you take medication for blood pressure, heart disease, or blood clotting. Please bring this conversation to that appointment. That is exactly where it belongs. What is actually happening inside your coronary arteries, and why the common understanding gets it wrong? To understand why a specific form of garlic can produce the clinical effects I am about to describe, you need to understand what is actually happening inside arterial walls when plaque develops. Because the popular understanding of heart disease, the idea that cholesterol deposits simply accumulate like sediment in a pipe, is incomplete in ways that matter for treatment. Atherosclerosis, the medical name for the process of arterial plaque formation, begins not with cholesterol but with inflammation. The inner lining of the arteries, the endothelium, becomes damaged over years of exposure to oxidative stress, elevated blood sugar, smoking, elevated blood pressure, and the chronic, low-grade inflammatory state that is increasingly common in aging adults. This damaged endothelium becomes adhesive. LDL cholesterol does not simply drift into healthy arterial walls. It accumulates in areas where the endothelium has already been compromised by inflammation. White blood cells migrate into those damaged areas in an attempt to repair them. Over time, they become trapped, absorb fatty molecules, and transform into the foam cells that harden into the calcified deposits visible on a coronary CT scan. The insight this picture provides is significant. Cholesterol is often more passenger than initiating cause in this process. The fire that sets plaque formation in motion is inflammatory damage to the arterial wall, and any intervention that meaningfully reduces arterial wall inflammation is addressing the process at its actual origin, rather than simply managing a downstream marker. This is precisely where the ingredient I want to describe does something that current standard treatments do not directly target. I want to tell you about a patient I will call Eleanor. She was 67 when her cardiologist reviewed her coronary CT scan and identified measurable calcification in 2 major coronary arteries. A statin was prescribed and dietary changes were recommended. Eleanor followed both instructions faithfully. But at her 6-month follow-up, she asked her cardiologist whether anything else existed. He mentioned somewhat briefly that some research had been published on a specific form of garlic in the context of arterial health. Eleanor spent 3 weeks reading through that research herself. She found the clinical trials I am about to describe. She began a specific protocol with her cardiologist's full knowledge and agreement. 14 months later, her follow-up imaging produced a result her cardiologist described as remarkable. The progression of her coronary calcification had completely halted. Her C-reactive protein, the blood marker of systemic inflammation, had fallen by 38%. She is 71 now, still on the protocol, still monitoring. The chemistry that makes this work, and why the form matters. Absolutely. The ingredient is garlic, And the first thing I need to say clearly is that this is not about eating more garlic and cooking. It is not about garlic powder on food or inexpensive garlic capsules. The specific form and the specific preparation method determine whether the cardiovascular compounds actually reach your arteries. Getting this wrong means receiving none of the benefit. Understanding the chemistry is what makes the distinction logical rather than arbitrary. When a raw garlic clove is crushed or chopped, two substances that are kept separate within the intact clove come into contact with each other. An enzyme called allanase meets its substrate allan, and the reaction produces allicin, one of the most potent anti-inflammatory and antioxidant sulfur compounds found in any food source. The difficulty is that allicin is chemically unstable. Heat destroys it within minutes. Your stomach acid degrades much of it before it can be absorbed into the bloodstream in concentrations sufficient to produce measurable cardiovascular effects. This is why the benefit of cooked garlic and most commercial garlic supplements is limited. The delivery mechanism fails before the active compound arrives where it is needed. Here is the discovery that changes everything. When raw garlic is aged slowly in a cold environment over a period of approximately 20 months, the unstable allicin compounds undergo a complete chemical transformation. They become stable, water-soluble organosulfur compounds, the most important of which is S-allylcysteine. These transformed compounds are highly bioavailable. The body absorbs and utilizes them efficiently. They retain the anti-inflammatory and antioxidant properties of fresh allicin, but without the instability that prevents raw garlic from delivering those benefits to the cardiovascular system. This transformed product is called aged garlic extract. It is what the randomized controlled trials have been studying. And the distinction between aged garlic extract and any other form of garlic is not a marketing claim. It is a documented biochemical difference with documented clinical consequences. The clinical evidence, what randomized controlled trials have actually found. I want to walk through the research specifically and precisely, because the strength of evidence here is what separates this from the enormous volume of health claims that circulate without genuine scientific backing. A randomized controlled trial published in the Journal of Nutrition, conducted by researchers at the Los Angeles Biomedical Research Institute at Harbor-UCLA Medical Center, enrolled 55 patients who all had measurable calcium deposits in their coronary arteries, the kind visible on a CT scan. Half received aged garlic extract daily for 1 year, half received an identical appearing placebo. At the end of 12 months, the aged garlic group showed zero progression in their coronary artery calcium scores. The placebo group progressed at the rate that would be expected based on their baseline measurements. But the finding that drew the most attention was in a specific category of plaque called low attenuation plaque, the soft, unstable type that when it ruptures causes heart attacks. The garlic group showed a statistically significant reduction in soft plaque volume. The significance of this finding is difficult to overstate. The study was not merely showing that progression could be slowed. It was showing that a specific type of dangerous plaque could begin to diminish. The blood pressure research on aged garlic extract is equally compelling. A comprehensive meta-analysis published in the Journal of Integrative Blood Pressure Control reviewed 20 separate randomized controlled trials and found that garlic supplementation reduced systolic blood pressure, the upper number, by an average of 8.3 millimeters of mercury. To contextualize that figure, most first-line antihypertensive medications aim for a reduction of 10 to 12 millimeters of mercury. Achieving merely that effect from a food-derived compound with an established safety profile is not a minor clinical finding. The same analysis found average diastolic reductions of 5.5 millimeters of mercury. For someone whose readings sit in the borderline range, that magnitude of reduction can represent the difference between needing medication and managing without it. There is a third mechanism that the research has revealed, one that most people do not expect, and that takes the cardiovascular case for aged garlic extract into territory that no statin has ever reached. A 2019 study published in the journal Nutrients found that regular aged garlic extract supplementation significantly increased populations of beneficial lactobacillus and bifidobacterium bacteria in the gut, while suppressing the growth of harmful species. The clinical relevance of this is considerable. The gut microbiome is now understood to be a primary regulator of systemic inflammation throughout the body, including within the walls of blood vessels. Disrupted gut bacteria populations are increasingly implicated in the progression of atherosclerosis. Aged garlic extract appears to address arterial inflammation upstream, at the level of the microbial environment that governs it, a mechanism that no pharmaceutical cardiovascular intervention currently targets. Finally, aged garlic extract has a documented antiplatelet effect. Research published in Phytomedicine found that it inhibited platelet aggregation, the tendency of blood components to cluster and form clots, by up to 58% in certain participants. This is the same fundamental mechanism through which low-dose aspirin provides cardiovascular protection, though the pathway differs sufficiently that researchers believe the two may be complementary for appropriate patients, rather than simply duplicative. Let me share a second experience that illustrates what these mechanisms look like in a real person. I will call him Gerald. He was 74, had been on a statin for 6 years, and his LDL was well controlled. On paper, his numbers looked entirely reasonable, but his C-reactive protein, his systemic inflammation marker, was persistently elevated at 3.8. His blood pressure, despite antihypertensive medication, consistently ran around 148/90. He began the aged garlic protocol I am about to describe, with his cardiologist's full knowledge. At 12 weeks, his C-reactive protein had dropped to 1.4. His blood pressure was averaging 133/82. At his next appointment, his cardiologist reduced his antihypertensive dose. His cardiologist's comment to him was direct: "Whatever you have added, continue it." The protocol matters as much as the ingredient, and I want to be specific about every component, because the difference between the products studied in the clinical trials and the generic garlic supplements that fill pharmacy shelves is real and consequential. The specific form you need is aged garlic extract, not garlic oil capsules, not garlic powder, not deodorized garlic, not raw garlic cloves. The words aged garlic extract must appear on the label. The product used most consistently in the coronary calcium trials is one called Kyolic Formula 100, which is widely available at pharmacies, health food stores, and online. A 2-month supply typically costs between $8 and $12, which is the source of the $2 figure referenced in the title. Per month, this is genuinely one of the most affordable cardiovascular interventions supported by actual randomized controlled trial data. The dose used in the coronary calcium studies was 1,200 milligrams of aged garlic extract daily, divided into 2 equal doses. Take 600 milligrams in the morning with breakfast and 600 milligrams in the evening with dinner. Divided dosing maintains more stable blood concentrations of the active compounds across the full 24 hours. Always take it with food. Absorption is better and the stomach tolerates it more comfortably. If you are new to supplements or have a sensitive digestive system, begin with 600 milligrams daily for the first 2 weeks, then increase to the full dose. When choosing a product, check for 3 things on the label. First, the words aged garlic extract must be present, not simply garlic extract. Second, look for standardization to contain S-allocysteine. This is the key bioavailable compound that your body actually absorbs and uses. Third, look for a USP-verified or NSF-certified seal. These markings indicate that an independent laboratory has tested the product and confirmed that the contents match what the label states. Quality control in the supplement industry is inconsistent, and these third-party certifications are how you verify that the dose you are taking is actually what you intend to take. Allow a minimum of 8 to 12 weeks before evaluating the effect. Inflammatory markers such as C-reactive protein often begin to shift within 6 to 8 weeks of consistent daily use. The coronary calcium studies ran for a full year to document the most significant effects on plaque. If your doctor already monitors your CRP levels, ask for a baseline measurement before you begin and a follow-up reading at 12 weeks. Having objective data to compare is both informative for you and useful for your doctor in tracking your progress. The antiplatelet and blood pressure effects of aged garlic extract are real and clinically meaningful. That is what makes it effective, and it is also why certain combinations require medical oversight before you begin. If you take warfarin, clopidogrel, aspirin, or any other antiplatelet or anticoagulant medication, speak with your prescribing physician before adding aged garlic extract to your routine. The additive antiplatelet effect is genuine and requires medical supervision. If you have surgery scheduled within the next 2 weeks, Do not begin the protocol until afterward. And if you are already taking garlic extract, discuss stopping it in advance of the procedure with your surgeon. Because the blood pressure effect is meaningful, averaging 8 millimeters of mercury systolic in clinical trials. If you are already on antihypertensive medication, monitor your blood pressure more frequently during the first month, particularly if your current readings already sit in the lower normal range. You may find that your medication requires adjustment, and your prescribing doctor needs to be part of that decision. Anyone taking immunosuppressant medication should consult their doctor before beginning, as garlic compounds can interact with certain drugs in this category. And anyone with a known allergy to garlic or related plants should obviously avoid it entirely. What amplifies the effect? Building a broader anti-inflammatory foundation. Aged garlic extract works most powerfully when it is not fighting alone. The underlying driver of arterial plaque, chronic low-grade inflammation, responds to multiple simultaneous inputs, and the garlic does considerably more when the broader inflammatory burden has been reduced through complementary habits. Omega-3 fatty acids from high-quality fish oil, in the range of 2 to 4 grams daily of combined EPA and DHA, work through a different anti-inflammatory pathway than garlic and produce synergistic effects on arterial inflammation when used alongside it. The mechanisms complement rather than duplicate each other. Regular walking, 30 minutes, 5 days a week, meaningfully amplifies the blood pressure benefit of aged garlic extract. Movement is one of the most potent stimuli for endothelial nitric oxide production, which relaxes arterial walls and reduces the mechanical stress on vessel tissue. The garlic supports nitric oxide availability through its organosulfur compounds. Physical movement supports it through a completely separate physiological pathway. Together, the effect is additive, reducing added sugar and refined flour, not eliminating carbohydrates broadly, but specifically the rapidly absorbed, heavily processed forms, substantially lowers the glycemic and inflammatory burden that contributes to endothelial damage in the first place. When the arterial environment is less inflamed, the garlic extract has less work to do, and its effects are more pronounced. Think of it this way. The supplement is most effective when the dietary conditions that created the problem are also being addressed. The research we have discussed today carries a message that I believe is genuinely important and that does not receive sufficient emphasis in standard cardiovascular conversations. Plaque progression is not inevitable. It can be halted. With the right combination of interventions, specific types of plaque can begin to diminish. The clinical trials on aged garlic extract are not testimonials or health industry claims. They are peer-reviewed, mechanism-confirmed, reproducible findings, published in respected journals and conducted in real patients with measurable coronary artery disease. Aged garlic extract, standardized to contain S-allyl-cysteine, taken at 1,200 milligrams daily in 2 divided doses from a third-party verified product, has more rigorous clinical support for cardiovascular benefit than almost any other supplement available without a prescription. Its effects on coronary plaque progression, blood pressure, systemic inflammation, gut microbiome composition, and platelet activity have been studied independently and consistently, and its cost places it within reach of virtually anyone. If this conversation has given you something your medical appointments have not fully provided, a specific, evidence-based tool to discuss with your doctor at your next visit, then it has served its purpose. Print this out if it helps. Bring the names of the specific trials to your appointment. Ask your doctor to check your C-reactive protein alongside your standard lipid panel. The information exists. You now have it. Use it in the best possible way, in partnership with a doctor who knows your complete health picture. I am Dr. Naira Stein. Your arteries are responding to the environment you create for them every single day, through what you eat, how you move, and the specific inputs you choose to provide. The environment is something you can change, and the research shows clearly that when you change it in the right ways, the arteries respond. Take good care of yourself. I will see you in the next one.